Going to make a quick introduction. Good evening, everyone, and thank you so much for joining us this evening. On behalf of Biote, my name is Nancy Pagan, Practice Development Manager for Biote, and tonight's host and moderator. Tonight, we will be discussing the amazing benefits of bioidentical hormone replacement therapy. I would like to draw your attention to the right-hand side of the screen. This is where you can submit any questions you may have at the end of the webinar. Without further ado, I would like to introduce Dr. Christina McAteer and Rebecca Hassel, nurse practitioner, our certified hormone replacement specialist from Oceanside Aesthetics and Wellness. Dr. McAteer.
Wonderful. Thanks so much, Nancy. And again, welcome to our attendees. I appreciate you taking the time out of your busy day to join us. This is really meant as a general introduction for us to understand a little bit about hormones and understand what they can do for you. We will have some time for questions at the end as well, so certainly make notes, or I'm also happy to answer questions as we go if that's easier for folks. But Biote has prepared this slide deck. We'll follow along, and hopefully that gives you a nice, gentle intro to what Biote is and their approach to things. And of course, we can always answer individual questions at your consultation as well. So Biote, this is a patient seminar, and it's looking to understand how small things can make a big difference. And you can see there the palm of the hand, which shows the size of the pellet. That's a common question that we get asked. And so you can see that it is quite tiny. And as you will find out, that is placed in the fat of the butt cheek. So something that you really are not even going to be able to see or feel once the implantation of the pellet takes place. So questions are, what are hormones and why are they important? And then more specifically, what is hormonal imbalance? And of course, as we age, what happens to our hormone trends during that period of life as well? So Hormone Havoc, what do you need to know? Who can and should you believe? And understanding a little bit about what hormone therapy can potentially do for you. So as many of you know, we all have hormones circulating throughout our body. They're thought of as chemical messengers that will signal certain glands and organs to have actions at the cellular level within our body. They work in a lock and key function. So each hormone binds a specific receptor and has a specific action. And then, of course, the question is, do we age because we lose our hormones, or do we lose hormones because we age? So some concerns that folks may have is they may feel like this, or potentially like this. You can feel like this young man here, or more ideally, like this young couple here. And so if any of these looks or symptoms sound familiar to you, that is a sign that potentially you have a degree of hormone imbalance. So extreme fatigue, particularly hitting that wall earlier, later in the afternoon, mood swings, anxiety, tension, sleep difficulties, memory loss, depression, a lack of focus, brain fog, hot flashes, night sweats, weight gain, all symptoms of menopause or the midlife transition, joint pain, even bladder symptoms, of course, migraine headaches, and then decreased sex drive or performance, all related to hormone function. So the Biote method really looks at three particular hormones: testosterone, estrogen, and thyroid. They also use medical grade nutraceuticals to impact the results of your hormonal therapy and give you an improved result of the investment that you're making. What's key to know here is that it is an FDA regulated process, specifically the testosterone, and all the nutraceuticals are obtained from a 503B pharmacy. That may not mean much to you, but to us, what it means is that this is a very high level pharmacy with certified procedures for sterility and cleanliness and ongoing maintenance and upkeep to ensure you that you are getting a very high quality product. During the whole progression of the Biote method, we will be routinely checking labs. We will be using their dosing site to understand the exact dose that's right for you. It will involve pellet implant, and again, that can be testosterone and or estradiol. We will additionally at times be recommending thyroid supplementation, again, based on your symptoms, based on your lab results, and then the ongoing nutraceuticals, which are the medical grade, ensuring us that it is a product that's delivered safely to you and contains exactly what it should be. Andropause, a term that may not mean anything to some folks, but this is really typically thought of as the male change in life or the male progression as testosterone levels start to fall in middle age. And so male menopause, or andropause happens to men in their 50s, and 20% of those men in that category will have low testosterone, particularly if you have diabetes, high blood pressure, sleep apnea, and some of the other common diseases of modern life. You will be more likely to potentially feel the effects of low testosterone levels. This is linked to early heart disease and often underdiagnosed. You see lots of testosterone commercials online and on TV. So if you're worried that you may be going through andropause, we'd be happy to talk to you more about it and check your levels to see where you are. Testosterone, typically thought of as the male hormone. Interestingly enough, women also have testosterone, so that's something that we'll be monitoring and checking for you. But testosterone provides major symptom relief and is protective for the bone, brain, breast, heart, and your relationships, with a nod toward the libido impact. These hormones, again, are present in both men and women, typically larger amounts in men, smaller amounts in women. But as we age, unfortunately, that hormonal level tends to trend in a downward trajectory. So men will lose 1 to 3% of production of testosterone each year after the age of 30 and beyond. And women actually have a much marked decline in their testosterone level. So when we think about testosterone, we're actually looking at the levels. So you can see in the graph to the right, at different levels, you're going to have different symptoms. And so that way you can kind of match the symptoms to what your level is. And that's one thing why I love the Biote method. It's not just black and white. It's not one size fits all, but it's really concentrated on how you're living and how you're feeling. And you can see that the higher the level is, potentially the more protection you have, all the way up to being protective against the Alzheimer's disease at the higher levels. It also can help with dyslipidemia, atherosclerosis, arterial stiffness, hypertension, all components of vascular disease, as well as abdominal obesity, sarcopenia, and your exercise tolerance. There are many positive effects for natural or bioidentical testosterone for both men and women, and they include the list here: increased energy, improved feeling of well-being, depression and anxiety relief, improved cognition and memory, improved focus, enhanced libido and sexual performance, as well as protection for the breast, prostate, brain, and heart, increased bone and muscle strength, reduced body fat, and lower cholesterol. All good reasons to keep testosterone in your system. Menopause, probably a term we're all more familiar with, which is the mark of the woman in middle age as our estrogen levels start to decline. About 6,000 women enter menopause daily. Symptoms can take years to develop, and as you know, the process itself can take years. Most women are affected in more ways than they realize, particularly because the symptoms are vague and can be representative of a number of dysfunctions. But a lot of women never really get through menopause completely. And so it's really important to think about your symptoms when discussing menopause. What we do know is that premenopausal women have a 1 in 7 chance of dying from heart disease. Postmenopausal women, that risk jumps markedly to 1 in 3 women. That tells us that estrogen is very cardioprotective. We know it has a lot of effects on the vascular system, and therefore we would be very interested in optimizing your estrogen levels and keeping you safe, protecting you from our nation's #1 killer. Estrogen, the key female hormone. Estrogen as well is present in both men and women. This hormone is present in larger amounts of women, smaller amounts in men, and it has multiple functions in the body and probably more that we don't even know about. It does control hot flashes, maintains bone density, helps maintain memory. It gives collagen protection and support in the skin, which is a desired effect for many of us. It also increases serotonin and dopamine, the so-called happy hormones in the brain. The positive effects of having estrogen in your system, again, it controls hot flashes, helps with the collagen, it helps give the serotonin dopamine balance, helps with bone density and bone strength, memory, prevents neurodegenerative conditions like Alzheimer's disease, helps with your cholesterol portfolio, specifically decreasing LDL and increasing HDL, and it is protective to the bone, breast, brain, and heart. So why would one consider hormone therapy? There are two major ways really to execute hormones or to get them into your body. There is synthetic, and those can be a combination of pills, patches, or injections. What we use with Biote is bioidentical hormones. That can also be in pills, patches, and creams, but what we prefer here at Oceanside is pellets, and that really is the technology that Biote has championed. So the conventional wisdom of hormone replacement therapy, many of us go back to the Women's Health Initiative, and what we've learned is that it actually was a flawed study. They showed many negative effects for hormone therapy, and that scared a lot of patients and actually caused a lot of women to go off hormone therapy. What we learned is that it was the type of hormone that we were using for that study that really led to the erroneous conclusions. A lot of the components in that study have since been retracted. However, that hasn't made it to commonplace knowledge. Many women choose to receive estrogen support through patches. Estradiol levels are better with patches than with pills, but still not as good as with pellets. You can face issues with adhesion. They need to be changed throughout the week. They can be associated with weight gain, fluid retention, and 45% of people actually don't even absorb the hormone through the skin. Creams and gels also have complications. Do you wonder, have I applied enough? You have to rub it on a couple times a day. It's hard to remember. Say you have a crazy busy day and you forget your dose. There's a very short half-life with creams and gels. And of course, you never really know if you have absorption. There is the risk that you can transfer this medication to those in your environment. For example, if the cream is on your skin and you hold a child with skin-to-skin contact or touch your pets, you could actually transmit the hormone into their system as well. And most importantly, estradiol does not protect the bone, heart, and brain. And that's been proven in multiple research studies. So we prefer the Biote method, knowing that information. There is injectable testosterone. The risk here is similar to the creams. You can have uneven absorption. There's a significant roller coaster effect. Most times it's injected twice a week. So during that week, you're at least having peaks and troughs. Some people actually leave the injection to just once a week and inject an even higher dose, leading to more peaks and troughs. Most times the injectable testosterone is synthetic, and it has been associated with significant adverse effects, specifically liver toxicity, heart disease, as well as adversely impacting your cholesterol profile. It always wears off for the next shot, and unfortunately that leads to lots of mood swings, making those in your family who are on injectable testosterone not so great to be around. So why have we chosen bioidentical hormone pellets, and what are the benefits for you? So bioidentical hormone pellets are, again, natural plant-derived compounds. They have the same molecular structure as the human hormone, thus the name bioidentical. They last longer than other treatments, so in the range of 4 to 5 months for women, 5 to 6 months for men. Therefore, you're not facing the same issues with the dosing frequency. It is the most widely studied form of bioidentical hormone replacement therapy on the market. It provides a steady stream of hormone in the blood, therefore eliminating the peaks and troughs. The dosing is individual to you. It is implanted underneath the skin surface, as I hinted at earlier in the presentation. So once that implantation is done, there's no maintenance and you don't even know that it's there. There's a long-standing history of pellets. A lot of times people don't know that you can get hormone in a pellet form, but actually this type of pellet implant has been around since the 1930s when it was initially studied. At that time, there was discussion about the use of estradiol and testosterone pellets to help alleviate the symptoms of menopause. And since that time, there's been over 80 years of use that's been studied in multiple research studies from countries around the world. You can see here a nice graph, and that is suggestive of the point that we made earlier about the peak and trough. So you can see the implant there is green, gives you a nice steady state. So you're not having the dosing swings and therefore not having the dosing complications, such as issues with memory, fatigue, moodiness, etc. So what is the Biote method of pellet therapy? Well, the goal really is to help return to normal the hormone balance in the physiologic state. So it has three key components: getting you the right kind of hormone. So again, something that is identical to you, very natural based dosing, giving you the right amount, so individualized to you, and giving you the right delivery system using pellet therapy. So what is Biote? It's a safe, evidence-based study of hormonal implantation using the pellet therapy. It's clinically effective with no roller coaster effect. It's convenient. There's a low side effect profile. It is the best method when studied to show improvement in bone density. There is no increased risk of breast cancer, no increased risk of blood clots, heart attacks, or strokes, as we found with synthetic hormones. And studies have shown that hormone optimization actually protects the breast, bone, brain, heart, and your relationship. A lot of times, one of the big questions we face is that of breast health. So the big question is, if I'm on hormones, am I at a higher risk of developing breast cancer? And the actual take-home message is no. Testosterone delivered by pellet does not increase the risk of breast cancer. Testosterone implants have less stimulation of breast cancer. Treatment with testosterone and estradiol does not increase the risk of breast cancer, even in those who have a known history of breast cancer. And estrogen alone does not increase the risk of breast cancer. So hormonal replacement after a diagnosis of breast cancer in relation to recurrence and mortality. They have done studies, as you can see here, with over 2,700 women ranging from age 35 to 74. And they found that the breast cancer recurrence rate was actually lower in women who are on hormone replacement therapy. And the breast cancer mortality rates were lower in women on hormone replacement therapy. And the total mortality rates were lower. All evidence that this is a safe therapy to give if you're concerned about breast cancer, or again, even if you've had a history of breast cancer. The question is bone health. I think any women in the audience are certainly worrying about that or thinking about that as a huge issue for osteoporosis and osteopenia in our society. So what can hormones do for us with our bone health? We know that testosterone is the bone builder, and there's a 4-fold increase in bone density over oral estrogen and over patches. And so when you're on pellet therapy, you can have an 8.3% increase in your bone density per year, obviously less so with other modes of estrogen replacement therapy. Arthritis, unfortunately, as we age, it is not uncommon to complain of joint aches and pains. And we actually found that 10% of men and 18% of women actually have arthritis as we age. Both estrogen and testosterone actually stimulate precartilage cells and can potentially reverse the development of arthritic tissue. Brain health, this is another big one for me. Depend on our cognition being in tip-top shape for performance in today's modern society. So the big question is Alzheimer's disease. Am I at risk? And unfortunately, women get Alzheimer's disease 8-to-1 over men. What's good to know here is that women on estrogen therapy are 50% less likely to develop Alzheimer's disease. And men with low testosterone have a higher risk of Alzheimer's disease. So if you come to us and seek further Biote therapy, we will optimize your hormones, and that will be protective of you going forward. Heart health. As we all know, cardiovascular disease is the #1 killer of men and women in our country. And estrogen replacement with pellets has an actual positive effect on body fat in postmenopausal women and a more favorable impact on your lipid profile. It decreases total cholesterol and LDL, the so-called bad cholesterol, increases HDL, the so-called good cholesterol, and decreases triglycerides. When you add testosterone, you do not negate the favorable effects of the estrogen on the cholesterol, but you also now gain a reduction in the fat mass when women were on estrogen plus testosterone when studied at a 2-year time interval. Many, many studies have shown the natural benefit of testosterone on the heart. For men, there may be questions about hormone in the heart. And so again, if you're looking at testosterone pellets, we see here again a favorable impact. The decrease in the total cholesterol and LDL, the decrease in triglycerides, and an increase in HDL, again, the good cholesterol. Metabolic fats, there is a reduction in fat and improved lean body mass when on testosterone pellet therapy. And there have been many studies to show this effect. If you have specific questions, please let us know. And of course, at any time, we'd be happy to share these studies that you can review for yourself and share them with your healthcare provider as well. So what are the takeaways when considering hormonal therapy and specifically the Biote method of hormonal therapy? A couple of things to remember is that we are all at risk for hormonal imbalance. It can occur in both men and women, and it can start at any age. Not all hormonal replacement therapies are equal, and achieving hormone balance is not a one-size-fits-all approach. When you look at lab ranges, low normal may not be optimal for you. When we do your blood work, which is the necessary component of your hormonal dosing, we'll be looking at hormonal levels, specifically vitamin levels such as vitamin D3 and B12, as well as your thyroid. And depending on that, with your symptoms, we will make further dosing and therapeutic recommendations. Please visit the Biote website to learn more, or certainly we invite you to come into Oceanside where Rebecca or myself will be happy to answer any questions that you have with a complimentary consultation. Speaking to the nutraceuticals component that Biote recommends, again, recalling the fact that these all comes from a 503B pharmacy, the highest grade of sterility and accuracy of dosing that you can achieve. There are multiple supplements, and we can certainly talk to you about those and make recommendations. One that's really key to us living in the Northeast and particularly key to women is the ADK. That has vitamin A, which is essential for bone development and immune support. Vitamin D, we also know, essential for bone and developing and maintaining calcium and bone support. And then vitamin K, also for bone support. So almost always it will be recommended that you're on an ADK supplement as part of your Biote therapy. All right. So that concludes the presentation, but we're certainly happy to take any questions you have, both Rebecca and myself here, to answer any thoughts that you have going forward.
That was great, Dr. McAteer. I'm looking here to see if we have any questions coming in. Let's see here. One question, maybe silly question. Is this covered by insurance or private pay?
So this is private pay. Unfortunately, insurance does not cover this at this time.
And how about the labs?
So You have two options. Biote has partnered with a company called Access. So you have the option to get your labs drawn right in the office, both at the time of your initial consult and when you come back for pelleting. And then about 6 weeks after that, we do check some blood work again in females and about 4 weeks in men. That cost to you is around $88. There is the option to get labs done by your insurance as well. And we can help facilitate that if that's an option for you as well too.
Okay, great. Another question. How do I get started? What's the next step?
So the next step would be to actually call our office and make an appointment. So we actually book about an hour-long consultation appointment, and that's complimentary if you do not decide to get lab work at that time. And we'll sit down with you for about an hour and kind of go through this in a little bit more detail and kind of get to the nitty-gritty. And again, there's no contract or fee. We just want you to feel better. So a lot of this is overwhelming information for people because it's a lot all at once, and it kind is very different from what we're kind of taught and what we know as both providers and patients. And so we kind of encourage people, if you have more questions or on the fence, more information can only be better. So we just encourage you to call and make an appointment.
Okay, a few more questions here. How long will it take for pellets to get into my system?
So they usually start to work within 2 or 3 days. You'll notice some symptom relief, specifically sleeping better and your energy levels up. Usually by 2 weeks, you start to feel pretty significant benefits of that. And then by 2 month mark is where we really start to see dramatic improvements in your symptoms. Most women need to be repelleted around the 4 or 5 month mark. Men, it's a little bit longer than that. It's 5 or 6 months, but we really gauge when you need to be repelleted based on your symptom recurrence. And so sometimes it takes, a year of going through the cycle to kind of figure out what that time point is for you. But we're with you throughout that whole process. So any side effects you're feeling or symptoms you're feeling, we work with you throughout the whole process to make sure you feel good and you're feeling a lot better.
Fantastic. Two more questions here. Will I need to take other medications?
So, in some situations you will. So if you're a postmenopausal female with a uterus, or you're a young female who happened to have a hysterectomy and does not have a uterus, we do give you a prescription of something called progesterone. And progesterone really prevents your lining of your uterus from building up and getting some breakthrough bleeding. And so we give 200 milligrams of that at night. And the good benefit of that is it actually helps you sleep as well too. So if you are a female and you have a uterus and you're going on estrogen therapy with the pellets, we would be prescribing progesterone. We would recommend in certain cases, based on your symptoms and your blood work, starting you on a medication called NP thyroid, which is an all natural desiccated thyroid hormone that kind of targets a specific active thyroid hormone called T3 in your body. But that's tailored for each individual patient, is on a case by case basis. We also recommend the line of nutraceuticals, which is not a prescription, but kind of an adjunct and support to getting the pellet therapy.
Another question. Any known allergic reactions?
I mean, I haven't heard of any allergic reactions to this. Certainly there can be localized reactions to some of the cleaning agents we use, sometimes the tape, but to the actual pellets themselves, I don't believe there's any risk, but maybe Nancy or Christy can comment on that further.
Just to note that we do use some localized anesthesia with lidocaine. So we will obviously ask you if you have any allergies before we go forward with the procedure. We use a small amount just to numb the area topically just prior to the insert. But as with everything, let us know if you have any allergies.
Right. And just to the point of the pellets, there are no known allergens with the pellets. Are pellets FDA approved?
Correct.
Yes,
Yep.
yes, they are.
Yep. So the FDA governs the dosing of testosterone specifically. So by that effect, we have a couple obligations. One is how we store and keep the pellets and the inventory that we do. So Rebecca and I have undergone extensive training to make sure that we are in compliance with FDA certification. but the other is also in the amount of dosing that you get with each pellet. So as you probably know, when you purchase medications, you may think that you're always getting said dose of your medication, but that can actually vary depending on whether it's generic or brand name. But you can have confidence with the Biote because it is FDA certified in the way that they produce the pellets from the 503B pharmacy, that you are in a 3% range. So you're getting just about as accurate dose as humanly possible.
Okay, and will pellets help me lose weight?
So pellets themselves aren't an indication for weight loss, but they happen to be a great almost side effect of pellets. So when you get pelleted, your energy levels up, you're sleeping better, and so people are oftentimes more active. The testosterone in and of itself can cause some decrease in fat circumference or buildup of fat, particularly in women. But overall, we do see patients who are pelleted do end up losing weight, but more importantly, building muscle.
Great. And waiting to see if someone else has a question.
There's a question in the chat box. Has anyone ever used an FSA card? We have not had that experience here in the office specific for Biote therapy. However, we have had that for other therapies, and it's been covered. I don't know how much experience people have with FSAs. I certainly use mine at CVS, and I buy things like fluoride and vitamins, and I've never had an issue. So I would anticipate that this would be covered with your FSA. If there's any questions, we can always try to run the card and just make sure that the charge is valid before we proceed with therapy.
Okay, any other questions we may have?
And I guess just to speak with FSA, that would be applicable for an HSA too, a healthcare savings account versus a family savings account. So I would expect that both would work, although I haven't personally tried it, and happy to try it if you bring your card in.
Okay, that was wonderful. Wonderful presentation, Dr. McAteer and Rebecca. I hope everyone enjoyed this amazing and educational webinar this evening. Please reach out to Dr. McAteer and Rebecca and schedule your complimentary consult as soon as you can. Thank you so much for a wonderful evening.
Perfect. Just want to say on behalf of Oceanside, a thanks to Biote for your support tonight, and a thanks to all of you who have shown up. Nancy has graciously said that she would take attendance, and I will be happy to offer a $25 gift card to Oceanside that can be used of a service of your choice going forward. So you will receive that in the mail as a thank you for taking the time to attend tonight's webinar.
And if you come in and have a consultation and make an appointment with us, you'll get a free bottle of ADK2 for joining us tonight.
Good night, everyone.
Thank you all. Bye. Be well.
Bye.
Not ADK, just one free.